All right, hello everyone. Welcome to Module 3 for Foundations of Healthy Lifestyle Management. So the topic for this module is lifestyle medicine. So now we're getting into more of the meat of healthy lifestyles and healthy lifestyle management. All right, so what I wanted to do was just provide a high-level overview about lifestyle medicine, what it means, what are the components, at least the components that we are going to emphasize in our program and here at Creighton. This is just again, a short video that gives you an introduction to it, but there's some resources at the end that you can dive into it a little bit further, but at least you'll get your feet wet as this course is really foundational and we're laying some of this groundwork here. We'll get into this in, of course, much more detail as we continue to move forward in the program and with the other courses. So here's a little background for you. I think we may have talked about this already, but in 2008 we started the Cardiovascular and Diabetes Risk Reduction Program here at Creighton. It's an employee health program for folks who have high blood pressure, high cholesterol, diabetes, pre-diabetes. And one of the major components of this, of course, is healthy lifestyle behaviors. And lifestyle medicine is a pretty new field in the area of health and wellness and medicine. And I'll give you a definition here in a minute. So what we did is, for this program, is we create individual recommendations that we work with Creighton employees on for each of the components that we feel are important for lifestyle. And those would be, and we'll talk about these in detail, in a little more detail in a second, but basically it's physical activity, it's healthy eating, it's sleep, adequate sleep, it's stress management or coping with stress, it's alcohol moderation, and tobacco cessation. And then, of course, wrapped all of that, around all of that are health behavior modifications that allow the individual to do those types of things. So just a little context for you. Here's a couple of trivia facts for you, if you like Trivial Pursuit, the old game Trivial Pursuit. Looking at each one of these in isolation is okay, and what percentage of folks do these types of lifestyle behaviors is okay. But we tend to look at them in more of a cluster to see folks doing multiple positive lifestyle behaviors. And the percentage of Americans, if you look at just physical activity, and we'll talk about what the recommendations are in a minute, but the number of Americans, or percentage of Americans who participate in adequate amount of physical activity, at the same time they're eating enough fruits and vegetables, and at the same time are not smoking, the percentage of Americans who can do all three at the same time consistently is only 5%, a little above 5%. For those who do not have heart disease, for those who have heart disease, it goes up to about 7.5%. So 5% is not much, right? And so it's that area that emphasizes to us, okay, we have 75% of our healthcare costs in the United States are due to preventable conditions. Most of those are related to lifestyle behaviors. There have been the inter-heart, inter-stroke studies that have been done a while back, which showed that 90% of the causes for heart attacks and strokes are related to lifestyle behaviors. And we know that cardiovascular disease has been a leading cause of death in the U.S. for over the last century. But what are the causes of those and of cardiovascular disease? Majority of what causes cardiovascular disease, if we're going to take the next step back, are lifestyle behaviors: inadequate exercise, not enough inadequate nutrition, fruits and vegetables. And so where we need to be, so that of course is lifestyle related, but where we need to be, and we'll talk more about this in the next couple modules, is taking that next step back. Why are people not exercising? Why are they unable to eat healthy and not getting enough sleep, and so on? So bring this back around to the risk reduction program that I mentioned. when we started meeting with these folks on a regular basis, and by regular is about once a month, working with them on their personal lifestyle behaviors, but also really the reasons, what gets in the way of them, or the barriers to doing healthy lifestyle behaviors. We started to see, of course, an increase in their ability to do multiple lifestyle behaviors at one time. A lot of the research says we should just do one at a time, but just from a health behavior side. But we do it a little bit differently. We feel like we start with one that can easily be implemented, and then we add another, and then we add another. And so what we found out in our research was that after about a year or so, we get up to about 30% of the people who are in the risk reduction program who can consistently exercise at the recommended amounts, consistently eat fruits and vegetables at the recommended amounts, and not smoke. And for our baseline, it was right at 5%, just as the national data said. We're showing that folks, even out to 5 years of being in the program, can still do these things. That about a third of them can do them simultaneously. So that's good news, and there's I think strategies that we can put into place to help us get towards that higher percentage of our folks doing those things all at the same time. So anyway, let's get on with some of the slides here. So let's define lifestyle medicine. This is a definition that was collaborated on from the American College of Lifestyle Medicine, the Australian Lifestyle Medicine Association, and the European Society of Lifestyle Medicine. So as they define it, what they say is lifestyle medicine is a branch of evidence-based medicine in which comprehensive lifestyle changes, including nutrition, physical activity, stress management, social support, environmental exposure, are used to prevent, treat, and reverse the progression of chronic diseases by addressing their underlying causes. So just as I had mentioned before, our issues are heart disease and cancer. Those are the largest issues we have as far as chronic diseases go, is at least related to causes of death. And we know that a big portion of those are related to lifestyle factors. And so getting at the root cause is really where we need to be. I personally think the definition falls a little bit short in that it doesn't go back far enough. It does talk about social support and does talk about environmental exposures, but I think that area is largely underrepresented, not well understood. And the other piece of the definition that is that falls short is that it talks about a branch of medicine, and largely when people think of medicine, they're thinking about physicians. But I think it would have served them better if they would have said evidence-based care or something like that, rather than just slotting it into medicine, because lifestyle medicine is very broad and can encompass all of the health professions and wellness professions. So the components that we will work with you on to get you the information you need to know are really going to be these here as you go through the program. So health behavior modification, physical activity, healthy eating, adequate sleep, coping with stress, alcohol moderation, and smoking cessation or tobacco cessation. These are the specific lifestyle medicine behaviors that we feel are important and most prevalent for you, most important for you to be able to have a good handle on when you're with the healthy lifestyle management major. So just briefly, what are the recommendations for each of these? And the recommendations for most of these come from the U.S. Department of Health and Human Services. But to be fair, there are many different groups or agencies or associations that put out recommendations for lifestyle behaviors. I try to make it as inclusive as possible for these, and it's easiest, it seems, to go with the U.S. Department of Health and Human Services in this regard. But you should recognize that there are others. But for the most part, they all basically come to the same conclusions. So for physical activity, and I use physical activity, by the way, rather than exercise, because physical activity is just plain old movement, right? So it doesn't mean that we have to, have this stereotypical notion of exercise that we have to get on a treadmill or we have to go run around a track or something like that. It can be just moving, and so the recommendation, and this is really based on the literature and around this, that the more we move, the more healthy we are, up to, of course, a certain level. But the recommendation is accumulating a minimum of 150 minutes of moderate intensity physical activity each week. So this could be 30 minutes 5 days a week. You can slice it up like that. You could do an hour at a time, 45 minutes at a time, 20 minutes at a time, but it's the accumulation of this. And this is where the data over the last probably decade has settled in, or maybe even longer than that, has settled in on this 150 minutes. So it looks like it's the minimum threshold for amount of activity we should be getting. And this is for adults. I didn't include that on here, but this is for adults. Kids actually 60 minutes a day. But that's a topic for a different day. But just speaking about adults, 150 minutes in moderate. So what does moderate intensity mean? And the intensity is defined by what's called a metabolic equivalent, or a MET level. And we're not going to get into this today. You'll get into this in other courses. But the easiest example for this would be to think of walking as a moderate intensity activity. And we're not talking about walking where you're just strolling, smelling the roses. It's actually a walk with a steady pace. It needs to be consistent, it needs to be rhythmic, it needs to be where the heart rate is up, breathing is labored, and done so for a longer period of time other than just a few minutes. So walking is probably the best and easiest example to think of for moderate intensity activity. So the definition goes further on. You can do vigorous activity. Vigorous activity is something less than 150 minutes, and they actually just cut it in half. And that again is related back to the data, but 75 minutes a week accumulated of vigorous intensity activity. Again, can be sliced up however you want. It is not recommended, however, to do it all at one time. So don't go out on a Saturday and do 150 minutes. It will give some benefit for sure, but not as much as if you consistently do it. And there's lots of reasons for that, but same thing goes for the vigorous, and maybe even more important for that, because sometimes the vigorous activities can create soreness, create injury, and not allow for it to happen on a consistent basis. So example of vigorous intensity, the best example, easiest example, maybe not the best, but the easiest example to think of is running or jogging. So walking for moderate intensity, jogging or running for vigorous. And again, the same thing, rhythmic, where the heart rate is up, breathing is labored, done so for a longer period of time. And so that's physical activity. Healthy eating. This is much more complex than what I can put in a short slide, but basically the recommendations for this from the U.S. Department of Health and Human Services. Again, the guidelines are dietary guidelines for Americans. If I go one slide back here, the physical activity guidelines for Americans is where the physical activity comes from. But the recommendations are on these four larger areas: balance, calorie management, intake, balanced calorie intake, so that we can maintain a proper weight. They have a list of foods and to reduce, and for the most part they are refined flours, solid fats, sodium, and added sugar. And those are the big ones. So those are the pieces to, and then of course alcohol in moderation. I'll talk about that in a second. Foods to increase, basically the three. This gets really complex, but as far as nutritional recommendations, but it all boils down to about the same recommendations: increase fruits and vegetables, increase whole grains, decrease added sugars, decrease refined flours. It doesn't talk about you need to be plant-based or vegan, you need to be Mediterranean, you need to be paleo, those kinds of things. All of those specific diets have shown pluses, but they've all shown minuses too, and they've all shown the ability to lose weight. and they have their place in certain individuals. Again, a topic for a different day, but that's not in the recommendation. And then building healthy eating patterns. So consistency is what they're getting at here. Sleep, one of the largely under discussed lifestyle medicine activities, but extremely important. Adults need 7 to 8 hours of sleep. This depends on where you look on this. Sometimes you see 7 to 9 on this, but a minimum of 7, but probably not more than 9 unless you need to make up for a deficit. Younger needs more, so teenagers need up to 10, and younger than that may need up to 12, but younger needs more, but adults and older adults, 7 to 8. And alcohol, moderate intensity alcohol. So the definition of moderate is for men 2 drinks a day, for women it's 1 drink a day. So what is the definition of a drink? It's 12 ounces of beer, 5 ounces of wine, 1.5 ounces of 80 proof distilled spirits. And here are some references. Can you tell I'm running out of time? I try to keep all of these less than 17 minutes, but here's a couple references for you. The CDC chronic disease website, and then I published a couple of books in this area, and this is one of those that you'll see further down the line in other courses. So there you have lifestyle medicine, just a very broad, very quick overview. Again, we'll get into these in more detail as you continue on in your other courses. All right, we'll talk to you soon. Have a good one.